downtown Grand Rapids. Well, the kids are back in school, but for some parents, you may have noticed the kids struggling to get back into a sleep routine after summer.
That's right. So joining us with some tips is licensed psychologist Dr. Nicole Beurkens. Good to see you once again.
Thanks for having me.
All right, so we talked a little bit about last hour, just some of the things to kind of help kids get into that mode. But how do you know when the kids are having some trouble with sleep?
Yeah, there's several things that parents should be aware of that could indicate that their child has more of a sleep disorder that they would want to talk with their child's healthcare practitioner about. So some of those things are persistent snoring. Now, it's normal, you know, during allergy season or when we're congested with colds to have some snoring, but kids who are snoring most of the time or all the time, that can be an indication of a bigger sleep problem. Kids who are really restless, who really struggle to calm down for sleep, who are moving around a lot in the night. You know, the kids, when you go on vacation, no one wants to share a hotel bed with them because they're kicking and thrashing all the time. That can be an indicator of low iron, low magnesium, and some other kinds of things that might be going on. Kids who have a lot of night waking, they may fall asleep fine, but they're up regularly during the night, not to use the bathroom, but just because they can't stay asleep. Some of those things can be indicators that you would want to talk with your child's healthcare practitioner about that.
Didn't know the kids could be affected at such a young age.
Well, and actually something important to know is that a lot of kids diagnosed with ADHD actually have an undiagnosed sleep problem. And this goes back to some of that restless sleep. The research shows anywhere from 25 to 40% of kids who end up with an ADHD diagnosis, what's really going on is they're not getting enough restful sleep at night, and that's causing the inattention and the other problems. So if your child has those issues, sleep is definitely something you want to look at.
Is there something in their room that could possibly be causing that problem?
So creating a comfortable and sleep supportive environment is really important, and there's several things to think about there. One is actually temperature. We don't want the room to be too warm. Cool is actually better for sleeping. Obviously, we want kids to have comfortable bedding. You know, some kids like to create nests around themselves with all their stuffed animals and pillows. Other kids, it's like they just want to sleep with nothing on them. Let them decide what's comfortable for them. You also want to make sure that the room is dark enough. Light coming in, whether that's through, you know, shades that maybe aren't closed all the way or bright lights outside. You want to make sure that you have room darkening shades and curtains, and also night lights for younger kids. While that can be helpful for, you know, calming their fears, bright lights in the room at night, even with a night light, can disrupt sleep. So if you have a child who really needs that, keeping the brighter night light maybe in the hall, outside the room, so there's still a glow out there, they're not so scared, but it's not in there. Teenagers now, you and I were talking about this, like to have those Christmas lights and things, you know, up decorating their room. That's fine, but we want to make sure that those are shut off at night. And the same thing with alarm clocks, making sure that the child's alarm clock is not really bright right in their eyes. So a lot of them have dimmer functions now, or turning it so the light's not right there, because that can disrupt sleep. And then some white noise or even some calming, quiet music at night can also be really soothing and can help with nighttime disruption. So all ways to create a more comfortable, sleep supportive environment.
All right, perfect. And for folks wanting to get a hold of you or learn more, what can they do?
Yeah, my clinic is Horizons Developmental Resource Center, horizonsdrc.com.
Very good.
Thank you.
Good to see you.
Great to see you. Thanks.
It is